this is a big thing you have to implement. Is 30 days enough for it? Is that realistic?
Yes, I think it is. We've been working hard now for months to implement a plan, multifaceted plan. We built on that plan yesterday to make the border even stronger, Roger. It's being operationalized, started immediately yesterday after the call between the Prime Minister and the President, and we're moving forward.
What were the first things that were brought in yesterday?
The first things we're moving to do now are to implement, I think, the Canada-U.S. Joint Strike Task Force on fentanyl, working not only between our countries, but also within our country here, working with our provinces, working with our police of local jurisdiction, RCMP, CBSA, and others, because we've got to wrestle the scourge and the tragedy of fentanyl to the ground. It is the same challenge that the United States faces. So we're going to do everything we can. That fentanyl czar position that we announced as well, we're already beginning now to lend shape to what that role would be, which is very much integrating different actors in this space. We need folks who can reach out to our Health Canada folks, because we're standing up new laboratories to, for example, trace where are the precursors for fentanyl coming from? When did they come into the country? Trace and track. So we'll be doing that as well. The task force, the fentanyl czar. We're going to be listing cartels in this country under the criminal code as terrorist organizations, because we really want to follow their money and break up their activities in that regard, and give our law enforcement folks more authority to do so.
Let's talk a little bit about the fentanyl czar. Have any thoughts been given to who might that be? Are we talking RCMP, somebody from within public safety?
I think it's going to be somebody with credibility who can network through different actors and different organizations and tie it all together, because we recognize just the extent to which this fentanyl crisis is widespread. But remembering as well, just for viewers, that less than 1% of all fentanyl entering the United States is coming from Canada. That doesn't mean that there isn't pressure on Canada. We need to continue that good work. The RCMP has broken up some 47 laboratories in Canada, including the largest single bust in Canadian history of 95,500,000 lethal doses of fentanyl just a little while ago. We also have to remember it's a two-way street. We have some drugs, narcotics coming from the United States. This will also be part and parcel of that fentanyl response. So we're looking at this as one whole, and we have to keep reminding ourselves that this is a joint challenge, and we're going to tackle it together.
Did we get anything from the Americans with that joint task force? A little off topic, but guns. We know that a lot of guns, probably the majority of them used in crime, are coming from the U.S. Are they going to focus on that at all as part of this?
It was raised directly with the President by the Prime Minister. It's an issue that we're going to follow through on. The Canada Border Services Agency and the RCMP are giving thought to that now. They're actually starting today. I'm on the way down to the border at Emerson, just below Winnipeg, to see the CBSA and RCMP operations, as well as working with our Manitoban partners, including with Premier Canoe, who will be there and will be joining me there. So yes, this question of a two-way street, the border divides two countries. And, you know, Roger, we pride ourselves in saying it's the longest undefended border in the world, which it is. But we've got to work hard to keep it that way. And that's our challenge. And yesterday, our challenge was to stop the tariffs. Today, our challenge is stop the tariffs. We really don't think this is a productive way forward, that it will give a lose-lose outcome for both of our countries, as opposed to a win-win one, which I think we all want.